The future of the Mohawk Valley looks brighter than ever, with exciting changes on the horizon. Our healthcare system is working to meet those changes through our talented and compassionate employees, providers, and volunteers, supported by the most advanced technology and services. The mission of the Mohawk Valley Health System is to provide for excellence in healthcare for our communities. We're able to accomplish our mission with the support of our community, and we are grateful for our generous donors. Our donors include patients and families, community members, foundations, area businesses, and our own hospital family. Their gifts make a difference in the lives of thousands of people who depend on our services each year.
One of the stigmas with cancer used to be, the treatment is worse than the disease. But technology has really taken off. So we certainly have improved the cure rates. We certainly have improved the quality of life and significantly reduced the side effects of the treatment. And the donations certainly make a difference. We felt that there was a need for a new CT scanner. So the hospital did approach a few community leaders, and they were very generous in paying for this piece of equipment. And one of the things that struck me was one of the donors said, I can afford a plane to fly to Boston or fly to New York City for my treatment every day. But the reason why I'm donating it is for the people of this town so that they can have access to the same technology. So I thought that was very generous to think of the community, because 1 out of 3 of us will get cancer. 3 out of 4 families will be affected by it. So it's a far-reaching act of kindness in the field of oncology.
In 2010, I came to St. E's for cardiac bypass surgery. And the surgery went well, and I recovered well, and that fall I started cardiac rehab. When you complete cardiac rehab, you have an option of staying there under what they call the CHAMP program. You're in a perfect facility. You've got nurses all around you, and they're just wonderful there, and they encourage you to get stronger and be healthier. But the tools are getting old there, and funding just doesn't allow them to get newer stuff. So that's why I decided I wanted to make a difference, and where I could contribute to it so that they could get some additional equipment. And the net result is the other patients enjoy it, and the staff, every one of them comes up to you and says thank you, and that means a lot. It's just a wonderful organization there, and I just wanted to give back.
Grateful patients like Joe are extremely important to how we provide care to our patients. Philanthropy is a big part of this department, not only in cardiac rehab. We've benefited from software upgrades in our electrophysiology area, an anesthesia machine in our new hybrid room, an ultrasound machine used to guide catheters, minimally invasive procedures that we're now able to do, faster procedure time, better recovery. So that is tomorrow's technology that we're bringing in today, but I couldn't do that without philanthropy and folks like Joe.
The generosity of our community is a tremendous asset and help to us. It enables us to provide a lot of quality experiences from an educational standpoint for our residents, but also helps us to retain good residents into our community. And with that, we can continue to ensure that the quality of health care in our community will continue to be at the best level. And we're working on a new project with a simulation lab to work with a multidisciplinary approach to train both family medicine residents, nursing students, and respiratory therapists in a collaborative fashion.
The most important thing in a critical situation is teamwork. That's what we can build in a simulation lab, because we're going to put you through a team scenario where we're going to look for leaders. And the other thing about this whole room is you can really make things realistic down here. We have state-of-the-art mannequins that will talk, sweat, move, breathe, has pulses. The more realistic you can make it and the more you can go through simulations, the more comfort you're going to have. More comfort you're going to have, the better your skills are going to be, and it's going to display to the patient, and it's going to improve their comfort level. To put it simply, better training equipment means more comfortable staff, better outcomes, and lives saved. It comes at a cost though, and I am so grateful for the people who have donated to build this lab. Thank you just doesn't say it enough. You're part of the team. You're investing in healthcare in the Mohawk Valley, and you're making it better for every patient that we see.
I think philanthropy is very important. When you're in an emergency situation, it is vital to have the equipment that you need to save a person's life. And I'm sitting in one of the 2 trauma rooms that were gifted out of the generosity from the community. If these walls could talk, they would be able to tell you about the great saves that have been made in both of these rooms, which wouldn't have been possible without those donations. We're very grateful for that.
These rooms are equipped with very high technology, state-of-the-art machinery to help out the patients who are acutely injured or acutely sick. And it definitely makes difference. You just have to spend a day in the emergency department of our trauma rooms to see how much difference our ED team is making. And with their donation, we found that they are standing right next to us, saving the lives which we are saving in the emergency department, and they are equal partner in that process.
Gifts make an incredible difference in the lives of our residents because it's with those gifts of money that we enhance the residents' lives, that we provide for them the extras that we may not be able to give based on cuts that are made through Medicare and Medicaid. And truly, this is their home, so we want them to feel comfortable and to have the things that they want at their home. And you can see the impact of giving everywhere you look in this facility. For example, the room donated by the Humphrey family. The mom was here, they believe she received very excellent care, and so they put donations towards the room upstairs at the end of the hall. It's all done in an Irish theme and particular colors that she liked and pictures, and that kind of makes your heart swell because you've done a good job.
She actually had a couple of stays here. She had Alzheimer's, and as that progressed, that brings on all kinds of problems. So she was in the hospital with pneumonia, and she was also losing her mobility, had terrible arthritis. So she had to come to the home for rehabilitation, trying to regain her mobility, but that never really came back. And so then she moved up to this floor, and it was really a permanent placement at that point. When she came to the home the first time after her first hospital stay, she was disoriented. And so she'd wake up in the morning, not really know where she was, why am I here? So I would get here probably soon after she was getting up, and I'd kind of had a spiel I'd give her that, oh, you had pneumonia, Mom, and you were in the hospital, and now you're here at the home, they're just going to take care of you, you're going to do some rehab, and eventually we're going to get you back home. And there must have been one morning I didn't make it over, and when I came in later, there was a therapy aide who came up to me and said, oh, Jim, you didn't come this morning. She goes, but don't worry, I was walking by your mother's room and I heard her crying. So I went in and I'd heard your spiel. So I gave her your spiel about, oh, you were in the hospital with pneumonia, you're just here to rehab, and it's all just going to be to get you back home. So, I just felt like that person went, she was just doing her job, going to pick somebody else for therapy, but she stopped, took 10 minutes and came in and calmed my mother down. It's a difficult time, and the fact that they made it easier, kind of, I guess, made us want to give something back because they were so wonderful to Mom at the end.
The other significant donation was from a family towards its Never Too Late program, the computer system program that's on wheels and can go where the resident goes and can play music in the dining room, and yet they can email their loved ones, and there's a variety of cognitive games on there, and that was very, very giving and really pulled at our heartstrings.
Evan surprised us. He was born a month premature. His lungs were very premature for his age. He had fluid in his lungs, but thankfully he spent 8 days in the NICU with the most wonderful staff I've ever seen in my life. And I had happy tears and sad tears because 2 years ago I rallied all the local credit unions together to raise $20,000 to buy that incubator that he was in, and it was overwhelming. It was absolutely overwhelming. And without the facilities here, Evan absolutely would have been transferred to Syracuse, so we were fortunate that we didn't have to go that route.
It's stressful to have a sick baby. It's that much harder to have a baby that's not in your hometown. And for newborns who are ill, we need incredibly specific equipment, whether it's being able to provide a warm environment for them as their bodies are growing and getting used to their new environment, or providing medication or monitoring for them. That equipment is very expensive. And we are not able to do what we do here so successfully without the funding and the donations from all these wonderful people.
Philanthropy plays a critical role in our success. Your support helps us make the needed investments in technology and services so that we may continue to provide exceptional health care. That's true today, tomorrow, and as we move forward with the building of a new hospital for the Mohawk Valley. You make a difference. Thank you.